Winter threat. Coronavirus returns to reinfect. An international collaboration of researchers from Europe and China have found that temperature and humidity in the environment have an effect on the severity of COVID-19 symptoms. Comparing outcomes from more than 40,000 COVID-19 patients over the course of the pandemic suggests that the disease is more severe in colder months than warmer months, and that dry indoor air may encourage the spread of the disease. In today's video, we are going to take a look at how coronavirus reinfects, and why some people test positive again. But before we get started, please give us a like and subscribe to our channel. Understanding repeat infection risk. Is reinfection possible in people who had been infected with the coronavirus? A study published in May by scientists at Columbia University Mailman School of Public Health found that reinfections with endemic human coronaviruses are not uncommon, even within a year of prior infection. The team studied 4 other types of coronaviruses. Also, many studies are attempting to figure out how long the protection provided by antibodies will last. For other coronavirus infections such as severe acute respiratory syndrome SARS and the Middle East respiratory syndrome MERS, those who recovered had some form of immunity for about a year or longer in others. When it comes to other forms of coronaviruses which circulate regularly, the immunity period is shorter. Another recent study also explored how long the immunity against SARS-CoV-2 may last, and found that the antibodies protect about an average of 3 months. This will make the development of vaccines harder, since the vaccines are now being trialed to determine their safety and efficacy. Without a precise immunity period, some vaccines may not work as effectively. Coronavirus immunity and reinfection. Patients who test positive for the coronavirus again when they have already recovered from COVID-19 are not being reinfected, a new study reported. Since many people with COVID-19 have mild to no symptoms, the best way to find out how far the new coronavirus has spread could be to check private companies. These blood tests will show who was and who wasn't exposed to the virus. The hope is that people who were exposed to the current coronavirus would be immune. Your body can recognize and fight off the virus which causes COVID-19 when you have immunity. Yet, it is likely that people who have had COVID-19 can get sick again, and maybe infect others. Reports of patients discharged from hospitals in South Korea testing positive after their apparent recovery had raised concerns that people might get infected more than once with the virus in the short term, or that the infection would return. Yet, coronavirus diagnostic tests that cause COVID-19 depend on the detection of the genetic material of the virus. A positive result does not indicate whether a person is shedding viruses capable of infecting cells, which would signal an active infection. What is it about winter weather? Health experts expect cooler weather conditions to trigger a more intense COVID-19 infection transmission in the winter, warning that the disease will show a similar seasonal pattern in other coronaviruses as very likely. People tend to spend more time clustered together indoors in winter, with fewer ventilation and less personal space than in summer. Respiratory infections such as coronaviruses are transmitted by droplets released while a person is coughing or sneezing. Latest studies showed that the virus may even be airborne, and health experts are suggesting that colder and drier winter conditions strongly impact the transmission of flu-like diseases. It's not just in Game of Thrones that winter is always coming. It is also true in every health service, said Chris Whitty, England's chief medical officer. He warned a second wave of COVID-19 cases could be more severe than the first, adding that winter was always worse than summer for respiratory viruses, and there was a higher likelihood of transmission during the colder months. Coronavirus and the flu, a looming double threat. Uncertainty about the future seems to be the one sure thing in the coronavirus pandemic. No one knows if COVID-19 will persist at its current pace, or if recent increased interactions among people will spawn an onslaught of smaller outbreaks or a larger second wave. But a few things are clear. The virus that causes the disease is likely to continue circulating throughout the population until there is a vaccine, and flu season is only a few months away. The overlap of COVID-19 and influenza has epidemiologists and some policymakers concerned. The US may soon face 2 epidemics at the same time, they worry. and this combination could precipitate a crisis unlike any other. The worst-case scenario is both the coronavirus and the flu are spreading fast and causing severe disease, complicating diagnoses and presenting a double burden on the healthcare system, says Mark Lipsitch, an epidemiologist at Harvard University. A few states are planning for extra capacity in hospitals to deal with both illnesses. Though the new coronavirus and influenza viruses can cause some of the same symptoms, such as fever, cough, and fatigue, these similarities are mostly superficial. The pathogens use different receptors on cells to gain access to our bodies. As a result, SARS-CoV-2 could enter one way, while a flu virus slips in another. A study of about 1,200 patients conducted in Northern California and published in JAMA in April found that 1 in 5 people who were diagnosed with COVID-19 were co-infected with another respiratory virus. The risk of such co-infections is typically low, says Ben Cowling, an epidemiologist at the University of Hong Kong, but it gets higher when 2 viruses are circulating heavily in the same region. It's possible you could get infected with both at the exact same time if you're having a really bad day, he says. So why exactly is it that winter helps respiratory diseases spread? The reason why cold weather is presumed to cause cough, cold, and flu to spread is because cold air reduces inflammation in the nasal passages and airways, making us more vulnerable to viral infection, said Simon Clark, a specialist in cellular biology at the University of Reading in Britain. Cold weather also appears to see people spend more time indoors and crowd together. That increases the risk of getting infected. Most respiratory infections, like COVID-19, are distributed in droplets released when a person is coughing or sneezing. According to disease experts, when the air is cold and dry, those droplets are more likely to float in the air for longer, traveling further and infecting more people. Is the second wave already here? A second wave of coronavirus infections was already expected by virologists months earlier. The possibility of such a second outbreak, the more people violate the rules of conduct and the controls introduced to contain the pandemic. Now it's apparently rolling in. In certain nations, limits on lockdowns are no longer as strictly enforced. Germany, Spain, and Greece were among Europe's first countries to ease those measures. Hong Kong, Vietnam, and Australia are also among nations with eased restrictions. The WHO has warned that coronavirus can never fully disappear. It has stressed the possible consequences if people take the coronavirus lightly and return to patterns of conduct that existed before lockdown measures were put in place. In many countries, shops have reopened, as have restaurants. In Australia, the government has tightened restrictions again after several cases of infection among guests in pubs and bars. People's urge to travel is again on the rise, another reason for higher infection rates. Too many people gather in too many small places, parties happen again. Worldwide, the risk of infection is growing. In Germany, the number of infections at the end of July was sharply up. No vaccines until early or mid-2021. The virus spreads quickly and is still resistant to most of the world's population. By preparing people's immune systems to battle the virus, a vaccine would provide some protection. While countries struggle to find a cure for coronavirus, Germany's science minister has said any vaccine is unlikely to be effective until mid-2021 at the earliest. We're not going to expect a miracle, Anya Karliczek told a news conference. We will continue to assume that vaccines will only be available to the broader population beginning early to mid-next year. Some people have argued that when enough of the population have caught COVID-19 and produced an immune response to it, we will have reached herd immunity, and the virus will no longer be able to spread. But this is a misunderstanding of what herd immunity means and how viruses spread, and so is not a realistic aim for COVID-19 control. Herd immunity is what enables us to eliminate diseases using vaccines. The percentage of a population who need to be vaccinated to reach herd immunity is calculated using the basic reproductive rate. This is the average number of people that each person who catches the disease would naturally pass it on to without any medical or public health interventions, taking into account how infectious the disease is and how it is spread. So, combining wintry condition, population behaviors affecting spread, and unavailability of a vaccine until 2021, coronavirus is poised to return in winter. Why do some people test positive again? There are reports from different countries of people hospitalized with COVID-19 who tested negative when they were discharged, before testing positive again. However, a study from China found that those who retested positive didn't get any sicker. This suggests these people were intermittently shedding the virus and were at the tail end of their original illness, rather than getting a new COVID-19 infection. The nasal and throat swab test being used to detect the virus also can't say whether the virus is alive or not. Therefore, they could have just been shedding dead virus. This could explain why their close contacts didn't become sick or test positive. Do you think we will ever reach herd immunity? Or are you concerned about the double threat of the regular flu and coronavirus this winter? Comment down below. Please remember to hit the like, subscribe to our channel, and turn on the notifications bell for more interesting videos. Thanks for watching.